speech about vaccinations. So my main claim is that vaccinations need to be administered to all school-age children. Number one, there's a higher chance of disease outbreaks without vaccinations. They're also safe and effective with little to no risk, and they can save families money and their time. So my first claim is that there's a higher chance of disease outbreaks without vaccinations. The likelihood of a disease to spread throughout children whose parents continue to not administer vaccinations to them in school is extremely high. An example of this happened in North Carolina when an outbreak of chickenpox occurred in a private school to numerous children. At least 36 students were infected with chickenpox, which is more than 68% of the students in kindergarten because they had religious exemptions due to their parents not allowing them to get vaccinated. My second point is that vaccinations are effective and safe, and there's actually little to no risk of even providing them. So before every vaccine is allowed to be distributed and administered, it has to be tested numerous times. The Food and Drug Administration, FDA, and the Centers of Disease and Control Prevention, CDC, are involved in the sense that they use volunteers to test the effects of the vaccine on participants and to find the perfect or correct amount that should be administered to people. Out of the millions of people who receive vaccinations, only a small percent of them even get side effects. My third point is that immunizations can save families money as well as their time. When children attend certain schools, the school may have certain mandatory vaccinations that they must receive before they can even attend. But if the parents don't believe in the vaccinations, they have to resort to sending their children to private schools, which in turn are more expensive. Most of the vaccine-preventable diseases cause children to have almost deadly illnesses and maybe be even hospitalized. In the event that the child gets infected because they didn't receive their immunizations, they now have to pay for hospital bills, medications, and doctor's appointments that obviously they're going to have to pay for. Many parents won't vaccinate their children due to the myth that vaccinations cause autism. The reason why they believe this is because of a British doctor named Andrew Wakefield, when he started the controversy that MMR vaccinations relate to autism. This controversy started in 1992 when he tested 12 children with and without autism and found a possible link between the MMR vaccination and autism. This report was retracted because of the overwhelming scientific evidence that the vaccine was not the reason for autism. And yeah, that's it. Thank you.
All right, well, the proposition's a pseudo-policy claim. It's okay because you do try to stick to the issue of fact that there's a need to do this. The only need, though, that gets demonstrated is your one example about kids in a North Carolina private school who got the chicken pox. And chicken pox, not necessarily a desirable thing to have, but it's not necessarily dangerous either. And you say because these kids all had religious exemptions, and that's why I assume because they were in the private school together, so they all ended up with the chicken pox together. So, as a negative and a justification for having mandatory vaccination, that seems a little bit thin. There's a lot more information that would suggest what potential dangers are of not being vaccinated, for example, on the MMR thing that you're talking about, and other illnesses as well, other diseases that are prevented by vaccines. So it feels like this is just really underdeveloped in terms of the risk factor. The second argument about the vaccines being safe and effective, I don't know that there's a lot of dispute about that. In essence, you mentioned the one reservation that some people have listening to a study that's been discredited for 25 years. that seems like there may be some people that are influenced by that, but most of your argument on the third point seemed to suggest that people had religious exemptions, and that's why they were taking their kids to the private schools. And I don't know that example would undermine this particular issue. If you are a and I don't know what the religious groups are. If you're a Jehovah's Witness or a Christian Scientist or some other group that believes that that kind of intervention in medication is a violation of your faith, that's not going to change because of this mandatory requirement. And what's going to happen is that people are going to be forced to violate their faiths as a way of dealing with that issue. There might be some controversy about whether or not that is appropriate or whether it is a legitimate thing for the government to do. Those would be value claims, but that's a different issue than whether or not a need exists for doing this. I don't have any data about how many kids aren't vaccinated in the public schools. I just have some data that talk about the number of kids that weren't vaccinated in a North Carolina private school, and that's as far as it goes. There's an underwhelming amount of information in the speech, and this is not, like I said, the effectiveness of vaccines is largely easy to prove. The safety of vaccines is largely easy to prove, and I don't think there's much dispute on those points. The thing that there's dispute on doesn't really get discussed very much here, and it really needs a lot more development. All right, thank you.